afternoon, everyone. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Ian Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy. Good morning, everyone. Today, we're announcing 6 new cases of COVID-19 in the province. 2 in the central zone, 3 in the western zone, with the other one in the eastern zone. All but 1 are related to travel outside of the country, and the other is related to travel outside of Atlantic Canada. All are self-isolating. As of today, Nova Scotia has 45 active cases of COVID-19. And this is what we've been trying to achieve, keeping our protocols in place so that we are able to quickly identify cases and allow for self-isolation for 2 weeks so those cases can be resolved. Dr. Strang will have more to say on those cases in a few minutes. I want to address 2 issues, the Atlantic bubble and the border at New Brunswick. First, the New Brunswick border. Over the past few days, we have seen our numbers increase slightly. We have no sign of community spread, and that's a result of precautions we take here, including the requirement to self-isolate for 14 days when arriving in the province. As well, our COVID testing has increased considerably, so we are catching these cases. But we can't control what is happening across our borders. In New Brunswick, we are seeing more cases in the Edmundston area, where there is a lockdown and travel restrictions. Now we are seeing some variant cases in St. John, and more worrying, we're seeing some cases under investigation in the Moncton area. It is not believed these cases are linked to the cluster in Edmundston. However, in abundance of caution, and in consultation with Dr. Strang and Public Health, we are reinstating the requirement for New Brunswickers to self-isolate when they cross the border into Nova Scotia. As of 8 a.m., April 15th, the border restrictions will be put back in place. It means Nova Scotians traveling back into the province will also have to self-isolate for 14 days. This is tough, I know, but it's necessary given what we are seeing across the border and in several other provinces where the cases are increasingly rapidly because of the presence of variants. This is what we want to avoid here, an outbreak resulting from the more contagious spread. I've repeatedly said that my focus is on Nova Scotia and when looking at alleviating restrictions within Atlantic Canada, and so far our approach is proving successful. Secondly, the questions around the Atlantic bubble. We had hoped that on Monday, April 19th, we'd have the ability to move across our provinces without self-isolating in the Atlantic. This is looking unlikely right now. I'm meeting with my fellow Atlantic premiers either today or tomorrow to discuss how that might look in the future. But right now, we are leaning toward pushing back the reopening to sometime in May. It's the right move right now. We have been watching the cases closely and listening to public health experts and following the science. We've always said that our approach is flexible and nimble, and when we see science changing, we must act. That's what we're doing today. Let's be proud of our success here in keeping the case numbers low and most of our businesses open. While the Atlantic provinces must continue to remain vigilant, the region has been a model for success in controlling the spread of COVID-19. Now, I just want to speak briefly about something that we're able to do as a result of adherence to public health guidelines. Nova Scotia students have been very fortunate this year. They've been able to attend in-person classes for the whole year. But our students have sacrificed too. That's why I'm pleased public health and the education system were able to work together to allow graduations this year. Students, staff, and families will be able to gather in small groups in schools to recognize student achievement and success. They will have guidelines to ensure gathering limits and public health protocols are being followed. This is a large undertaking that will span several days for many schools. Accommodating it means that secondary schools will need to end a week early this year, and more details will be shared at a local level from the schools. I also know many of you are wondering about proms. This year, schools will focus on making graduation as special as it can be. They will not be organizing proms, but parent groups are able to organize as long as they follow public health guidelines, including the gathering limits. And for a vaccine update, we've administered 157,590 doses as of yesterday. This week is shaping up to be our biggest week yet, with over 50,000 doses going out in doctors' offices and pharmacies and at 114 locations. Today and tomorrow, public health and community organizers are running a clinic in the Preston Township at the New Beginnings Ministry, and about 300 community members will have appointments scheduled. We expect to hit 200,000 doses this week, a big milestone showing our progress in the vaccine rollout. Our plan is on track, and in some cases we're a little farther ahead than we anticipated. And if you look behind me, you'll see we're consistently delivering more vaccine every single week. Thank you, and over to you, Dr. Strang.
Thank you, Premier, and good morning, everyone. Nova Scotia's COVID-19 caseload is the highest we've seen in a while, and I know this is making people anxious. We're all seeing what's happening across the country, and we do not want it to happen here. Please be assured that public health is monitoring it all very closely. I don't take any COVID-19 activity lightly, but I am not sounding the alarm. The things we have in place, our 14-day quarantine requirement, our testing strategy, and our other public health measures have never been more important, and they are working exactly as intended. First, most of our cases are related to travel outside Atlantic Canada, or they are close contacts of those travel-related cases. People are quarantining as required, along with household members if need be, and so the virus is not spreading beyond these travel cases or their close household contacts. We are not seeing spread into the community. Second, the season has begun for temporary foreign workers to arrive in Nova Scotia to support our agriculture sector. These workers play a critical role in helping Nova Scotia farms grow food, and they support our provincial economy. We fully expected to see cases with these workers, and we are containing them with our strict requirements. The temporary foreign workers are tested upon arrival. They do their quarantine in separate hotel rooms, and they are tested again on day 12 before they finish their 14-day quarantine. Thirdly, there is more testing of travelers happening than ever before. Testing is mandatory for international travelers, and we're working closely with our federal colleagues on that. Nova Scotia is also asking everyone who travels within Canada to get tested at the start and near the end of their quarantine. And exempt travelers, such as rotational workers, truck drivers, military, they are asked to get tested 3 times when they return home to Nova Scotia, and they all have to follow protocols that minimize their exposure out in the community to other individuals. And we continue to encourage Nova Scotians to make asymptomatic testing a regular part of how they live safely with COVID-19. Given all this testing, we fully expect to see higher case numbers because we are looking for cases more than ever, and there are increased likelihood of travelers returning with COVID-19. What's important is that we are finding these individuals, people are quarantining when required, and we are managing the cases so there isn't community spread. We continue to closely watch the COVID situation in other Atlantic provinces. And as the Premier noted, as of Thursday morning at 8 a.m., we are reestablishing the need for people coming from New Brunswick to do a 14-day quarantine when they enter Nova Scotia. This is in keeping with the approach of acting early and cautiously that we've used from the very beginning of the pandemic. The border controls and the accommodations for those who cross the Nova Scotia-New Brunswick land border on a regular, sometimes daily basis that were in place in the past will be in place again. I know people have been wondering how the IIHF Women's World Championship can safely happen in Halifax next month. I want to reassure people that we are in ongoing discussions with Hockey Canada, the IIHF, and the Government of Canada, and we are working towards an approved plan. All of the players and officials and anyone involved with this event will have to quarantine for 14 days before the tournament. And the Team Canada selection camp starting tomorrow in Halifax has an approved plan, including a 14-day quarantine to ensure the health and safety of participants as well as the broader community. We are not giving exceptions. We are not compromising on the fundamental need for a 14-day quarantine in any way to accommodate this tournament. In closing, I won't tell you not to worry. We are in a pandemic, and a little bit of concern and caution about a third wave will help us stay committed and focused. However, it is important to continue to do what you have done for the past year to keep yourself and others safe. Nova Scotia is one of the safest places in the world. We are so fortunate to be able to do so many things that people in many other areas cannot because of COVID-19 activity. But this is not the time to let our guard down. It is a time when we need to maintain tight border control, widespread testing, and strong public health protocols and restrictions as we build population immunity with vaccine over the next couple of months. Chrissy.
We'll now take one question and one follow-up in the time that we have today. First question will go to Alicia Draus with Global.
This question is for the Premier. With the Atlantic bubble most likely being pushed back, I'm just wondering if there are any discussions specifically between Nova Scotia, PEI, and Newfoundland about doing kind of a smaller bubble until things kind of settle down in New Brunswick?
So I've only had just a very brief discussion with one of the premiers, and we intend to continue with our self-isolation with New Brunswick until, into the foreseeable future. And as of now, Newfoundland and PEI are fine. So I've asked the question, and I'll ask it again when we have our meeting. But they'll have to figure out if that's something that they have comfort with, and there could be logistical considerations that they'll need to make sure that they have in place if they're going to accommodate for that. But right now, our concern is just limited to New Brunswick.
Go ahead with your follow-up, Alicia.
And just as a follow-up, I'm just wondering, for Dr. Strang, can you give an update on if any vaccines or how many vaccines have been wasted, and what the protocol is in place if at the end of the day there are extra vaccines due to appointment no-shows?
Yeah, well, last time we looked, I don't have the latest number, but our vaccine wastage is well below 1%. We have very good protocols in place that to minimize any wastage. All of our clinics have processes that if they have vaccine, for instance, somebody doesn't show up for an appointment, they have processes in place to get other people urgently. Some of the pharmacies are using lists of their regular clients and then reaching out to them and to bring them in on short notice. Our community clinics also have processes to make sure that there are people that are available to use vaccine if somebody doesn't show up for an appointment. So we're very well aware of the need to minimize any wastage of this vaccine and have good protocols to do that.
Next question will go to Blair Rhodes with CBC.
It's for either one of you. With the number of cases that we're seeing coming from out of province, has there been any thought given to increasing or perhaps making mandatory testing for those arriving at Halifax International Airport?
Maybe you want to give an update on your conversation?
So first of all, we have international travelers have mandatory testing under the federal requirement, and we're working with the federal government. We're testing. We certainly have people domestic travel. Some of them are mandatory testing, rotational workers, specialized workers. Others we're strongly encouraging to be tested. We're working through at the airport. We're working with them first and foremost as using them as a workplace. There's a large number of employees there. There's a number of logistic challenges around how you would test large numbers of people without creating large backlogs. Even a single plane load, the time it takes to get everybody tested can take a significant period of time. So we need to work through that. We are testing travelers. It's just the question is the airport the best place to test them? So we're working through some of the logistic issues on that, using testing as workers first. We are certainly all the temporary foreign workers. They are given a rapid test as the airport as one of their charter flights come in, and then they're getting a second their swab as well for a PCR test. So we're learning from both of those and how we might apply it as we start to get more travelers potentially coming in through the airport. But just the fact that we're not doing testing for regular travelers at the airport doesn't mean that we're not testing large numbers of travelers in different ways. Where we're saying you go into quarantine, and then they're allowed to come out of quarantine under strict protocols to get tested within the first couple of days, and then again at around day 12 while they're in quarantine.
Go ahead with your follow-up, Blair.
On the subject of the hockey tournament, I'm just wondering, have you given thought to how this is going to work? I take it this will be a no spectators type event with a bubble for just the the teams and the officials?
No, we've said that the spectators would be allowed. They're at the two arenas here in Halifax and in Truro. Whatever the gathering limits allow for spectators now. We have spectators for Quebec Major Junior Hockey League teams. So whatever the rules are based on where we're at with the epidemiology for spectators would apply to this tournament. The other piece is, as I said in my remarks, the most important thing to protect Nova Scotians is make sure all teams and all participants, officials, and other people coming in, even from other parts of Canada, to participate in this international tournament have a 14-day quarantine period. And we've been very clear on that to the organizers, and we've signed off on that portion of their plan, that it's very clear. All that requirement for 14-day quarantine will be held. And there's, as I said, we're not making any exceptions whatsoever on that fundamental piece to protect Nova Scotians, just to accommodate this tournament.
Next question will go to Tim Biscay with the Halifax Examiner.
Dr. Strang, can you give us the lay of the land on the travelers? It's clear that almost all the cases now are travel related. Do we know how many people are entering Nova Scotia from outside Atlantic Canada? How many are international travelers? What percentages are positive? Do we have a breakdown on how many are rotational workers versus temporary foreign workers versus snowbirds?
I don't have a breakdown of all that information. We're certainly looking at temporary foreign workers to make sure. I talked with my team today. We're going to start looking at tracking much more closely the temporary foreign workers and what's the results of our testing as they're in quarantine. But I don't have a breakdown of all the different kinds. We could probably get that. Everybody who comes in has to go through our safe check-in process online, and that data is in there. We just haven't gone through and pulled all that data out to get a sense of that. To me, it doesn't matter where they're coming from and what reason. If they're coming here, they have to either quarantine or follow a strict protocol if they're exempted from quarantining. It makes no difference why they're traveling. The quarantine or their exempted protocol and the testing that goes with it is the important piece.
Go ahead with your follow-up, Tim.
On the hockey tournament, clearly these are elite athletes. They're not going to be sitting in a hotel room for 14 days. Will they have the opportunity to go work out and practice? Is that part of their quarantine?
So we're working through the operational plan, but what they actually have, so I'll use the Team Canada, which is starting tomorrow with their selection camp. They're quarantined in a hotel. For a number of days, they actually have to stay within their room. And then they're allowed to start practicing as a team. They're allowed to go in a controlled manner from their hotel to the arena where they have a dedicated change room, all the protocols in place. They have no exposure to anybody else. And then once practice is over, they go back to their hotel. So all of the teams will have the same kind of, a concept of a quarantine bubble that allows them to go between hotel and rink. But all of them will have a number of days where they're actually isolated from their teammates, where they're each going to be in individual rooms when they get here, before they could even get together as a team bubble. But the combination of individual then team bubbles is all going to be for that full 14 days, and they'll have no exposure to anybody outside of their team, even when they're able to go to the rink for that first 14 days.
We'll go to the phones. First question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. Premier, when you spoke Friday, you seemed optimistic about the bubble. Can you help us understand the specifics of what changed over the weekend? Is this because the cases were found closer to our border, outside of Edmonton region? And do you think that you could have taken this step in closing our border to New Brunswick a bit earlier?
Certainly, I think our plan has worked extremely well, and it was over the weekend that we saw some activity in New Brunswick outside of the Edmonton area, which is consistent with what I've said the whole time. If I see cases getting close to our border, where we see some traffic coming into our province on a regular basis from either Moncton or St. John, that we would act swiftly. That's what we did in consultation with public health. Thankfully, we've been able to act swiftly in the past, and that continues. We see cases in Moncton that aren't necessarily linked to Edmundston. They're under investigation, but this is the right move right now.
Go ahead with your follow-up, Lindsay.
I'd just like to push again on this. Do you think it could have happened sooner, recognizing that evidently there's always a bit of a delay in when cases are identified from one exposure? Do you wish potentially that prior to now we had closed our New Brunswick border?
No, I don't believe that we should be imposing restrictions that aren't based on any evidence or science. Even today, when you look at the cases, they're from outside of Atlantic Canada. All of them international except one which is from outside of Atlantic Canada. So we continue to watch the cases closely. Edmundston, as I've said before, does not have that regular traffic coming into our province. They were able to contain up until we heard on the weekend that we had 2 cases in St. John with a variant and 3 cases in Moncton. It's still a low amount of cases. They haven't raised from the yellow zone, but out of abundance of caution, we're taking this step right now. And that system has worked so far for us to be that nimble to take immediate action. That's what we're doing.
Next question will go to Natasha Pace with CTV.
Thank you. I just wanted to know, Dr. Strang, at this stage, do you think Nova Scotia will be seeing a third wave of the virus? I know a couple weeks ago when we talked about it, you had said you were going to try everything in your power to prevent that, but is that looking more likely?
No, I think, as I say, we're everything we're doing, as I said in my remarks, the border measures, the quarantining, the testing, holding with all Nova Scotians with public health protocols and restrictions, it's working. So we're seeing some slight increase in cases, still in single digits per day. We're far better off than other parts of the country, and all of those are almost all are related to travel and close contacts. But we need to continue to stay very cautious around these travel-related cases, so they don't get a chance to get a foothold here in the province. So we're doing all the right things. I don't see that our risk of having a third wave is any greater this week than it was last week, but we're still in this, while privileged, but also very cautious position that is we're going to maintain here until we get a significant population immunity from vaccine, which is going to be into June. So the next number of weeks we're in this position, and we're doing everything we can do from a public health perspective. But it's also why every Nova Scotian needs to continue to stay very, very cautious and vigilant as we get through these next number of weeks to prevent any introduction and spread within our communities of any of these variant strains.
Go ahead with your follow-up, Natasha.
Thank you. I know the vaccine is starting to roll out quicker now, but according to online models, Nova Scotia is still the slowest province at administering vaccine. Can you explain why that is? I know originally we were holding back the second dose, but now that policy has changed, there are still some people thinking that the rollout's going a bit too slow.
Well, I mean, what we're seeing is the percentage is a legacy of that decision to hold back that second dose that put us behind some other provinces, but that were very much the right decision at the time. We are on, if you look at the trajectory we're on, we are climbing faster than other provinces in terms of the number of doses we're delivering. And we'll continue to do that as our supply increases. We can only deliver as fast as the supply demands, and we're getting vaccine and getting it out in a very timely manner, and our ability, our capacity to deliver vaccine is ramping up quickly. And as we get more vaccine, as we get into May and June, we've already have the plannings in place that we have all the capacity that we ready to go to increase, to able to absorb and deliver increasing amounts of vaccine. So the narrative that we're slow is actually an old narrative. We're developing a robust, reliable, flexible, quality program that can meet the supply as we get it in a very timely manner, and we're in a faster growing trajectory than many other provinces.
Next question will go to Keith Doucette with the Canadian Press.
Dr. Strang, your counterpart in New Brunswick over the weekend basically stated that every case there is now a presumptive variant case. Are we anywhere near close to that here in Nova Scotia, given the epidemiology that's happening across the country as we find our own new cases?
Well, and we don't have that level yet. I mean, we're doing screening in our lab, and a number of the tests that are coming back, even from the screening, they have to go for confirmation or showing that they're a likely variant. But not all our cases are variant cases. At the end of the day, what the immediate public health response is, it doesn't change whether it's a variant or not. We're treating every case like it's very infectious, as we've done all along. And all the other things we're putting in place, as I've gone through earlier in the briefing around quarantine, et cetera. That's what we need to have in place. So any virus, whether it's a variant or not, has a minimal chance of being spread in Nova Scotia. I think the issue of the variants is for Nova Scotians to understand of why we have to all stay very cautious for the next number of weeks as we build immunity through vaccination.
Go ahead with your follow-up, Keith.
All right, and Dr. Strang, one clarification and then the actual question on the World Hockey Championships. When you mentioned the bubble, is that individual hotel bubbles or is it one hotel? And then my actual question is there a cutoff date? You've approved things, but if things change, do you have to have a set decision made by a certain date on the World Hockey Championships?
So there's a number of different hotels. Each team, first of all, they're each coming with their plans that for the start, they'll be within a team. They're in individual rooms, so they're actually individually isolated. Then at some point, they can start to get together and work out and practice as a team. Each team is separated from each other. There's no interaction between teams until games actually play. And even as the tournament goes on, the only interaction between teams is during games. They remain within their team bubble, if you will, even if they're once they're past the quarantine period. Certainly everything we've had, the agreements we've had with Hockey Canada, with IHFF and the Canadian and the federal government are that this is all contingent upon epidemiology. And if for some reason things go completely sideways, we will adjust as necessary, like we did a year ago when we actually, in short notice, canceled the same tournament. So we have that ability, and we'll always put the protection of Nova Scotians first ahead of any event, including an international hockey tournament.
Next question will go to John McPhee with the Chronicle Herald.
Thank you. I guess this would be for Dr. Strang. Regarding the lack of proms this year at schools, what rules will be put in place for the unofficial gatherings? And there might be a worry that these kind of gatherings could lead to spreading events.
So they'll be like any other gathering. Right now we have gathering limits that limit indoor gatherings to a maximum of 100, outdoor gatherings to 150, and a lot of public health protocols around that. So any community groups that are organizing this will have to follow whatever gathering limits are in place at the time. It's important that communities understand that. First, there has to be, by the order, there has to be a recognized business or organization to host an event. If there isn't, if it's just families getting together, then the maximum is 10. But if there's a recognized business or organization that wants to then put on and organize a prom, they can do so, but they're going to have to follow all the public health protocols that are in place. And what those are at the time, we'll adjust those as the epidemiology depends, up or down. But I think it's important that communities understand that the two things. The education system is focusing on graduation, recognition of educational achievement. It's up to communities if they want to organize proms. And if they want to have a larger prom, but more than 10, then it has to be a recognized business or organization that takes on the responsibility and the accountability of hosting that in a way that follows public health requirements.
Go ahead with your follow-up, John.
Yeah, still on the school theme. Premier, you mentioned school will be closed a week early. I assume this will affect exams and other school schedules. Do we know what kind of impact this will have on the school year?
No, I think just the fact that we need some time to start getting organized for grads and things like that, and I'm not aware of any need to cancel any examinations. They should be able to curtail the schedule at a local level, and any further details, you can certainly reach out to the department.
And that's all the time we have for questions, as the Premier has to get to the legislature. Go ahead, Premier.
Thank you. I continue to hear positive feedback about our vaccine clinics, how efficient they are, and how caring and professional the staff are. I'm planning to visit a vaccine clinic later this week, and I'm looking forward to seeing firsthand how the process works from start to finish. As I said, we are on track to hit the 200,000 dose goal this week. We have built a vaccine program that is equitable, flexible, and reliable, and our rollout is on track. Dr. Strang and I look forward to providing another update on Friday this week. Thank you.